I'm Linda Shell, Chair of the AAPACN Education Foundation. The foundation is dedicated to building and sustaining a strong post-acute care workforce by funding scholarships for CNAs, LPNs, and RNs. Since we were founded in 2014, the foundation has been able to fund $112,000 in education scholarships. We've helped students earn their RN, BSN, and Masters, and fulfill their goals of working as a nurse in long-term care. That is a big accomplishment. However, there's more work to do.
When I got the call that I was going to be receiving the Elevating Post-Acute Care Scholarship this year, firstly, I was surprised. And then I also felt really incredibly grateful and honored to have been chosen.
I was more so in disbelief, and I was also obviously very happy. I've never won a scholarship before, and to hear that I was awarded one, I was mainly shocked, but also overall very happy.
I was very excited to be able to focus more on my school and give more time to learning how to help people more.
It's kind of felt recognized for everything that I've been doing over the past few years. And as a nurse, it's just great to feel validated that way.
My journey into long-term care, I went to LVN school in the thick of the pandemic. And once I graduated back in 2021, I found a position within a skilled nursing facility, not too far from me, and I ended up loving it. That environment was interesting to me because I was constantly learning, and I still am until today.
I started right out as a sophomore in high school. I got my certified nursing assistant certification, and I started right away in long-term care and post-acute rehabilitation. Now, as a registered nurse, I've really just, fell in love with long-term care and have not looked back since.
I was always working kind of like the acute setting, but I didn't really have the opportunity to explore that long-term care. I felt that the impact that I was having in patients was pretty much like at the beginning or through a journey, but I wasn't able to really see what that looks like afterwards. Working with that population has been really fulfilling because I managed to really know people, create a really meaningful clinical relationships that are impactful.
From the start, I knew I wanted to be in healthcare and I knew I wanted to be hands-on, and I just felt that nursing was the best way. And so about 4 years ago, I got my first job as a certified nurse assistant, and I worked at my local nursing home in my town. I've really liked the connections I made in long-term care, and just being able to help people and seeing their improvement, and it's just really rewarding for me. What I love most about working in long-term care is getting to know my people on a personal level.
Being able to be impactful and seeing that impact in people, rather than just being in a quick passing by journey, just being more present in long term.
It's like a sense of comfort coming into your shift and seeing the people that you are already familiar with, and it's kind of like catching up with old friends, like when you haven't seen them in a while.
In long-term care, I'm able to foster those connections with my patients, and that's what really I love about it.
I love to learn. I've been always just trying to learn new things.
I'm an advocate for education, and I just really have a love for lifelong learning, and that's why nursing is a perfect profession for me. I feel like there's always room for growth, and there's always opportunity to learn more and get better.
I feel that is very important, especially every time that you are feeling a little bit stuck, to try to just challenge yourself.
I always feel like I can learn more and implement the things that I learn to empower my coworkers and also just improve patient care.
I'm learning so much that I'm really interested in, and I get to apply it when I go to work. I get to apply it on my patients and my residents, and it's very rewarding.
A big obstacle for me would be the financial burden of trying to manage work and education as well. So that is a barrier that I have faced.
That language barrier, just because like coming from a Hispanic speaking culture, it was something challenging that I needed to face back in 2012 when I decided to move to the UK initially. Being exposed to many different cultures as well, and trying to kind of like learn through all the differences, and at the end of the day, impacts care, you know?
Having the element of perseverance. I look at my course calendar and I'm like, we still have that much left to go. But, you know, here I am, like almost like literally a matter of weeks away from finishing. And I think the obstacle was just being able to keep going and keep pushing and continuing to do what you already know that you can do, and putting in the work and the time and the effort. And it's rewarding to be near the finish line and seeing all the work that was put in and seeing that pay off.
If you go into school and you keep an open mind and try to learn as much as possible, it will help you overcoming any obstacles.
Receiving the scholarship is allowing me to continue to do the work that I care about, and that is caring for other people and providing for those who can't essentially help themselves sometimes.
It's just giving me the means to be able to start a new journey and a new phase into my progression as a nurse.
It'll allow me to get started with my studies sooner and just be able to take that education and information that I learned and really just put it to work in this setting.
It's a great opportunity just to gain more knowledge, and it also keeps me more motivated to want to do better and want to be the best nurse I can be one day.
In 5 years, I see myself finishing my bachelor's of nursing. Hopefully I'll be done with that and working on a master's degree. I am hoping to be in a leadership position and a nursing leadership position in long-term care. And I also have some plans for, just community outreach and education in my area. So big plans for the future.
I want to be able to impact a community level positively when it comes down to health policy and to health access, especially in the population that I'm working with right now.
I see myself going back to my rural community and just staying in the long-term care, and it will allow me to have more one-on-one time with my patients, and will just be able to make them feel like someone is there for them and that they're not alone.
I would love to see myself, obviously becoming an RN, and to essentially expand on the skills that I already have. I anticipate that there's going to be a lot of learning curves, but in the next 5 years, I hope to just grow from whatever mistakes I am inevitably going to make, and to grow from the knowledge that I'm going to be given.
My biggest advice for someone just starting in long-term care would be to really just approach every interaction with patience and the willingness to listen.
Try your hardest to make personal connections. The residents and patients, they really appreciate that.
Some patients are maybe hostile or upset or apprehensive that they are in a long-term care setting, and we cannot control how they feel. My advice would be to treat them as if they were your loved one, if they were your mom, your dad, your relative, whoever, and just think like that patient you're dealing with at one point earlier in their life, they were like you.
Try to absorb as much information as possible, because with all that information, you will see the path to really keep going and keep helping people.
Building that rapport with your patients, residents, and their families will just be invaluable to you.
Be patient, be kind, and to be the kind of nurse that you would want your loved one to have.
Back when I was a director of nursing, one of my goals was to return to school and pursue a BSN, but I knew that I could not afford it. I loved working in long-term care, but believed my only option To pursue additional education was to leave the field. To my surprise, my administrator learned of my goals and advocated on my behalf to the organization, and they provided a scholarship for me. I don't believe that I would have ever gotten my BSN and continued for an advanced degree if they had not supported me financially. That scholarship not only helped me financially, but it reignited my passion for long-term care. I'm forever grateful to them. Each year, our scholarship winners share that same gratitude for people like you that help contribute towards these scholarships. The AAPACN Education Foundation hopes to expand our nursing scholarships, but we are depending on your help to get there. Please join us in giving today, and on behalf of past and future scholarship winners and the AAPACN Foundation, thank you, thank you, thank you for your generous gift.